Hello, and welcome again to another episode from our series on CYC MD. Every time we meet with different healthcare providers who provide us insights and tips on their focused area of practice that can better our health and lifestyle. With me today, I'd like to introduce one of my friends, Dr. Kelly Samuel. Welcome, Kelly.
Hi,
nice to have you.
Thanks.
And she will be helping us with exercise tips and how to bow down, how to lift things up, things that we need to know from a physical therapist.
Thanks for having me.
My pleasure. I know you're very busy. So actually, before we start and getting into the physical therapy details, if we could just get to know you a little bit more, so our viewers can get to know you as well. Where did you graduate from?
I graduated from New York Institute of Technology in Long Island.
Oh, and I'm sure that wasn't too long ago because you look great.
Thank you. It was about 4 years ago.
Wow, very good. And how long is the physical therapy program?
The graduate portion is 3 years, but you would have to do 3 years undergrad if you're in the DPT program starting out of high school, or what I did was 4 years undergrad at St. John's, and then I applied and I did 3 years grad at NYIT.
Wow. So how many years total?
7 years.
7 years, okay. Where do you work now?
I work at North Shore University Hospital. I'm pretty much there Monday to Friday from 9 to 5. I have a set schedule.
Okay, great. That's very convenient,
yeah,
too.
Very much.
You don't really find doctors with that schedule.
Not at all.
Wow, that you should be very blessed and thankful for that.
I
know
sure
a lot
am.
of doctors were on call overnight, never get to
None
see
of
their
that
family.
in my field.
That's great. So what would you say is most challenging about your job?
It's very physical. Despite the name physical therapy, I'm actually doing a lot of the work as well, not just my patients. So one of the most challenging is just getting accustomed to being on your feet all day and seeing different kinds of patients. Sometimes I have to be on the floor and the patient's standing, or you're just in different positions all day and you're on your feet all the time. So that would be challenging, and just dealing with different kinds of people. So you get to meet a lot of different personalities, and some are stronger than others in terms of pain tolerance, and then you just learn to adjust, and you learn a lot from your patients as well.
You almost get very personal with them when you get on that level.
I am a therapist, so they open up to me a whole lot, not just, where I'm there to help them either progress in their walking or whatever it may be. They kind of just tell me a lot of stuff about themselves as well.
Wow. So why did you choose the field of physical therapy?
Well, it is very much interactive. And that's what I like. I like to deal with people one-on-one instead of just, sitting behind a desk. That's not for me, but it's also not for everyone. You really do have to be personable and being able to touch someone as well. I can't just tell someone, oh, this is what you're going to do. I have to actually get my hands on the patient. And some people may not enjoy that, but I do, and I am very, warm and friendly with my patients, and they kind of respond to that as well, and it also helps in their therapy.
So I know we use the word physical and therapy a lot, so what is a physical therapist, and what does it mean to also go into, when somebody goes into rehab?
Well, physical therapy is a healthcare specialty which involves evaluating, diagnosing, and treating patients with musculoskeletal disorders. And the main purpose, what we do is have these patients reach their maximum functional independence. And that just pretty much means having these patients be able to walk, go up and down stairs, get in and out of bed, basic things that they're having trouble with, regardless of what it may be. And as PTs, we see a wide range of conditions, whether it's orthopedic, neurological, surgical patients, even cardiovascular patients. And the beauty of physical therapy is that we can work pretty much anywhere. Like, I work in a hospital, but we have PTs in a nursing home, in an outpatient clinic, in a school, and even in your own house.
Yeah, actually, that's actually great. I guess I would say, would you say like the job market is pretty vast in that sense?
You can find a job fairly easily in this field because you can work anywhere.
That's great. Not a lot of professions are also like that. Some people actually are very limited into
No, definitely.
where.
And then you can pick and choose where you want to be.
And I know, do maybe some people do maybe like two, like they have like the clinic, and then they
Yeah.
work also in a hospital, so they have like.
A lot of my peers who work in the hospital with me, they also do home care on the side. So after, an 8 to 4, 9 to 5 day, they see 1 or 2 clients after at their house, or even an outpatient clinic, which I used to do as well. So you can kind of vary, and you don't have to be stuck in just one setting all the time.
So can you describe for us some exercise tips in order for us to stay healthy? Because I know a lot of people, when they meet a physical therapist, they're always like, okay, well, teach me something so that I could, just feel good all the time.
Okay. Well, regular physical activity is really important to improve and maintain your health and really reduce the risk of any chronic diseases that you develop throughout your life. Generally, for the average adult, it's important to do a minimum of about 2.5 hours of moderate aerobic exercises in a week, in conjunction with about 2 muscular strengthening exercises as well. A lot of people are so busy with their jobs that they don't have time to really exercise. So the basic minimum of 2.5 hours could be incorporated as just riding your bike around the block, mowing the lawn, doing basic activities like that. But what's required in order for you to get an actual workout out of it is to increase your heart rate and to break a sweat. So if you're just doing just a walk around the block, it's not going to be enough. You really got to put your body, increase your heart rate, and put it into a little bit of an overload in order to get a real exercise. So you don't have to be at the gym every day and lifting weights and doing that kind of stuff if you don't have time. Like I said, you could just be mowing your lawn or gardening or going for a brisk walk, as long as you increase your heart rate and you break a sweat.
So getting into the field of the physical therapist itself, also, I know you probably encounter many people that have disc problems. So what is, when somebody tells you they have a disc, what does that mean? And what is a disc disease?
Okay, well, a disc, that's short for an intervertebral disc, which is located in your spine, in between your vertebrae. And
where?
Right in your spine, you have these little vertebrae, and in between each vertebrae is your disc. Okay, and that acts as a shock absorber for your body. So when you're walking, it really is protecting your vertebrae, which is your spine. Okay, and that holds your spinal cord from your brainstem to the back of your spine. So with that, disc disease really happens when you're doing a lot of repetitive things incorrectly and you're putting a lot of pressure on your disc. So the disc is really made up of this gelatinous kind of material inside, surrounded by a fibrous ring. So when that disc is under stress, it tends to swell. So the gelatinous material inside becomes bigger, pushing on the ring on the outside. And now that ring is bulging out. That's how you hear a bulging disc or a herniated disc. And that's pushing on the nerve that's right behind it. So when that happens, you're going to get pain, numbness, tingling down your leg or any affected part. Generally, it's down your leg into your foot. And that's generally what a disc disease is. And it varies from just minor numbness or tingling to the person can't lift their leg because it's really pushing on that nerve.
And that's usually, you said, through maybe over time that develops, right? Over time of doing something incorrectly, whether it's lifting something or doing a strenuous activity.
Exactly. That definitely could be a part of it. Also just trauma. You could fall and something could happen. You can just displace that disc.
So even like an accident.
Definitely.
So would you say that all disc-related problems or diseases require surgery?
Not all of them do, because it really depends on the severity of the problem. A lot of people are living just with bulging or herniated discs, and they don't even know they have one until years later when they have this back pain and numbness in their foot, and they don't know why it happened, and they go for an MRI, and they see that this disc is really pushing on the nerve. And the doctors are really the ones that will look at the MRI and they'll see how bad is this disc really impinging on this nerve and how is it affecting their daily life. And then that way they can kind of decide, well, this patient needs surgery because they can't really walk as safely as they did before. So then the doctor will really decide when the patient needs surgery, but not all disc disease needs surgery.
So somebody could live with
and
that.
A lot of people do. Majority of people do.
Okay. Because I know the word surgery would always scare.
It is a scary word, but not all of them do.
So we talked about disc disease and disc problems. I know a lot of things that physical therapists also face are back problems. What would you say are reasons that people may encounter back problems?
Well, like I said before, I mean, the disc is what's really keeping your back safe. But normal aging process, that disc kind of shrivels and becomes weak, and that's you can't avoid that. Just like arthritis, it's the same thing. It's just over time, wear and tear. Trauma, like I said, if you're falling, if you're picking something up the wrong way, if you're twisting your spine constantly and repetitive motions all the time, is going to put a lot of pressure on your disc, which causes this back pain.
So how do you recommend lifting heavy objects? I mean, I know sometimes we lift heavy objects when we're moving. We lift heavy objects at work. We lift, you know, even babies sometimes can be heavy objects. And how do we lift an object to avoid injury, especially when it's heavy? And we know, like, afterwards, it's only afterwards that we start feeling either it's back pain or whatever pain we experience. We experience the pain afterwards. When we're in the motion of it, we think we're like Superman.
Very good question. We're always lifting something, like you said. So proper body mechanics is really important to maintain the health of your spine. So there's actually a mnemonic. It's the 5 L's of lifting, and I would like to show you. Let's try to lift this vase, okay?
Great.
So let's put it right here. Okay. So the first L would be load. So you see your object, whatever it may be, it's the vase, and you see, am I able to lift this on my own? How heavy is it? Just by looking at it, I mean, you're eventually going to pick it up, but just by looking at it, am I able to lift this object by myself, or should I get help? Safety and the health of your back is number one at all times. So that's the first L, load.
Okay.
The second one is lungs. You always have to take some nice deep breaths in through your nose, out through your mouth. Never hold your breath when you're picking anything up, because that just creates a lot of pressure internally, causing other damages to your bloodstream, your vessels, and you don't want that, especially when you're lifting something and it's excessive. So breathe in through your nose and out through your mouth as you're picking it up. The third L is lordosis, and that's just a big word, meaning just the curvature of your spine. So your spine has a natural curve, and the lordosis is it comes in a little bit and then it comes back out.
Yes.
So when you're picking something up, you don't want your back to be flexed, you're not hunched over, and you're not twisting or bending in any way. You're just nice and neutral, back is straight. Okay, that's lordosis. The fourth L is lever. Pretty much basic physics. When you're holding something closer to you, it's going to feel lighter and easier to lift, as opposed to holding something with your arms out like this. It's going to feel a lot heavier. So lever, bringing everything close to your body. And the last L is legs, which is the most important one. So you're not lifting anything from your back, you're lifting with your legs, and I'm going to demonstrate. So all these 5 L's put together. You're going to come nice and close. You're going to
So we're load.
Yes, you already saw your object.
Okay.
Okay. So you're going to come close, you're going to breathe.
So that's lungs.
Lungs, exactly. You're going to come down, lordosis, so you're not hunched forward, you're not bent, you're not twisting, okay? You're going to pick up your object, deep breath in, use your legs, the most important L, and you're going to pick it up. So the whole motion is coming from your legs and not your back. You should never pick anything
So
up.
show us like an incorrect way of doing it.
An incorrect way. I'm not going to lift it.
Incorrect. Don't do this at home.
Don't do it. I'm not going to even pick it up because that's just bad, okay? Would be this way. And then as you lift.
I think that's
so
a lot of
legs.
us could be guilty of doing it that way.
Everyone even picks up, like you said, babies, they're not using their legs. You have to bend down and get really close to the object and then just pick it up. Everything should be coming from your legs.
Okay.
And that's how you maintain a safe and healthy back.
Wow, thank you so much. That was, I'm actually guilty of doing everything.
We all are. But now we know better.
Yeah. So we also know in our Coptic Orthodox Church and in our community and in church, we do a lot of bowing down and kneeling, whether it's when we do matanyas on Good Friday and we have to do 100 in each direction, or when we bow down towards the altar, when we sit down, we do a lot of that during the liturgy. I'd say, I don't even want to count how many times. How would you say would be the right way to do all that?
Okay. Everything that we do, especially in church with bowing and kneeling, we want to keep our back straight. Okay. So the same way as if we're lifting, but we're not lifting anything, whether it is we're going to, whatever it may be, we want to keep our back nice and straight and neutral. Okay. There shouldn't be anything out of the ordinary. Posture is number one. Exactly. Posture, good posture. The way you're sitting right now is perfect. Good posture, okay? You shouldn't be hunched. Even when you're doing something as simple as kissing Abuna's hand, you just want to make sure that you're not slouching this way. You have a nice straight back. Because you're doing this so many times, right. Eventually it's going to catch up to you. So you want to make sure that down the line you're not having any back problems because of everyday things that you're doing and you're not being careful of it.
So maintaining always that good posture.
Always good posture, which is hard to do, but just remind yourself to sit up straight and not bend and twist.
So what would you say would be one skill that a physical therapist develops?
Well, I would say patience would be a big skill because you are dealing with a lot of different people, and just being aware of the whole body itself. We're not just focused on, one part of your body. I have patients that come in that have problems with their ankles and their shoulders and their necks. There's so many different things. So you're exposed to a whole lot of different disorders and different diseases. So a skill would just be just knowing how to deal with each disorder properly and efficiently. And that's one of the beauties of physical therapy, is that you do see a wide range of everything. Right. And you just have to know the right way of doing each disorder properly and treating that disorder properly.
I know you probably deal with patients with knee replacement surgery. You probably deal with patients that come in after a sports injury, after a car accident, or just after any surgery that they may need to have rehab for.
Whatever it may be, exactly.
So you do probably see it all from head to toe.
Orthopedic and trauma, that's what we see. Yep, exactly.
What would you say is most rewarding?
Well, the number one thing is just knowing that at the end, whether it may be in an outpatient clinic and they're done with their therapy sessions, that they're not in pain anymore, that they're able to do their daily life as before the injury, before the surgery, whatever it may be, that they weren't affected. They're not, experiencing any pains, and they're able to walk. They're able to do things that me and you take for granted. So at the end of the day, I would have a patient that comes in and they can't walk and they're in a wheelchair, and whether it may be from a knee replacement or a stroke or whatever it may be. But at the end of their rehab, they're walking out the door waving goodbye, and it's nice to know that you kind of helped. They did all the work, but you kind of helped in educating and kind of motivating them, and knowing that they're walking out of your clinic makes you feel good.
Wow. That must really be truly rewarding for that. Just to see somebody coming in, not being able to do something, and then walking out the door. It's almost like they're a different person. And they probably do feel like they're a different person too.
They are, and they're very thankful, and they do all the work.
And I think also would you say maybe like the spirit of the person? Sometimes people, when they have that high spirit, like I'm going to walk, or I'm gonna get over this injury, I'm gonna get over this whatever, disability, or that you want to say, and their spirit actually motivates them and inspires them to get quicker, faster.
Of course. I mean, you're gonna want to help yourself. Right. I can sit there and teach them 100 ways of doing something and 100 exercises, but if they don't want to do it, they're not going to get any better. But luckily, I don't come across that often. People do come to me and they want to get better, they want to walk, they want to
get out.
Exactly. So they're very motivated. They want to be
in and out and just get on with their life again.
They're definitely very motivated, which is a good thing.
Thank you so much, Kelly.
Thank you for having me.
It was a real pleasure to have you.
My pleasure.
We learned so much, and I'm going to start.
Put it to use.
I will. I sure will.
Thank you.
Thank you so much. Pleasure to have you.
Thank you so much.
We hope you enjoyed our episode today on CYC MD. Again, thank you so much, Kelly. We hope you use the techniques and tips that Kelly had showed us. Until next time, God bless.